Cold weather isn't typically thought of as an exacerbating factor for acne, but of course, any inflammatory skin condition can worsen when the skin is dehydrated, and certainly the cold will dehydrate the skin. What makes it worse is that we fluctuate from hot to cold, because we're going from cold outside into a hot, centrally heated house, and back and forth. And also central heating itself will dehydrate skin. And when cells are dehydrated, they don't communicate as effectively with each other, and we need that communication to repair skin and keep on top of inflammation and ongoing damage. So certainly one can understand why skin would be worse off. The actually high humidity can sometimes exacerbate acne, because these cells swell and you can get acute blockage of the glands where the hairs grow from, called the pilosebaceous gland. And that said, many patients in the past have reported that when they go on a hot sunny holiday, their acne is much better. So of course there are variations from patient to patient, but the main thing is cold weather leads to dehydrated skin, which is not good, so you need to hydrate it better. Certainly, we've touched on in the past about hydration and ensuring the skin is hydrated. And particularly patients with oily skin, and often this is associated with acne, they are not keen to use moisturizers, because there's understandably a thought process going on that, I'm just going to make it oilier. But one has to understand that one of the key processes in acne is overproduction of this oil, giving you this oily skin. But if you look at the areas where the glands aren't focused, so we often call that the T-zone, where they are more concentrated, these other areas will tend to be dry, and that's actually the state of your whole skin. So if you moisturize the skin effectively, you will actually help reduce your own oil production. The problem is that many moisturizers have ingredients which are essentially waste products, byproducts from the petroleum industry, sold cheaply to the cosmetic industry, and these ingredients can often clog up the pilosebaceous gland, where the problem is happening, where you get this spot from, and make things worse. So make sure when you buy a product it says non-comedogenic, and if it doesn't say that, then speak to whoever's selling you that product to ask if it is something that's going to contribute to spots or something that isn't. So you want a non-comedogenic moisturizer to effectively moisturize your skin but not make things worse. There are two of my favourites I've got them here. This one from a company called Tebi Skin, Ceraboost. This is amazing. This is ceramide based cream, but really, really good in any skin that's suffering with dryness, but particularly with acne patients. Marvellous, and this on its own, we've had a few patients say that they've already seen improvements in their skin. And of course we've recently launched for our own clinic Celderma, and this hyaluronic cream with plant-derived squalane is also very good and non-comedogenic, and really does help with skin hydration as well. One of the most common ingredients patients will have heard of is salicylic acid, and this is found in usually 2% strength in a lot of over-the-counter products targeted for acne patients. Salicylic acid is a derivative similar to aspirin, from salicylate, and it has an anti-inflammatory effect. It's a very small acid molecule, so it can get down into the pilosebaceous gland, which is blocked in acne, and it is effective. It's used in 30% strength in our chemical peel treatment that we use for acne, which does have other ingredients in it as well, but it is key. An ingredient that I love, which is another acid, pyruvic acid, is not talked about enough in my opinion. It's less irritant. It actually penetrates deeper into the pilosebaceous gland than salicylic acid. It slows down oil production. It also has a whole host of other benefits. It helps with large open pores, often within weeks. It works a little bit on remodeling of the skin, etc. So I love pyruvic acid, and that's one of the key ingredients in the cleanser that we use in our triple lock program that we prescribe to acne patients to use at home, and they love it. Another key ingredient in that program is OSK, and this actually is kind of like a brand name that has multiple different active ingredients within it, including a peptide called GT peptide 10. And these various ingredients have a synergistic effect, and collectively OSK actually works and is the only thing I know of that works on all 4 key pathological processes in acne, i.e. the overproduction of oil sebum, the disordered cellular growth and proliferation that occurs, which leads to that blockage of the gland, the bacterial overgrowth, P. acnes bacteria, and the resulting inflammation. So it actually combats each and every one. And if you look at a lot of the over-the-counter, the prescription products that are given out, that I used to prescribe as a GP, they often will only work on 1 or 2 aspects, most often the bacterial overgrowth, but you really have to work on all those processes if you're going to see any improvement in the acne. And although with these ingredients we're not directly working on hormones, which we know is a key exacerbating factor for acne, they do, some of the ingredients like the OSK ingredients do actually work on reducing DHT sensitivity. And if you look up DHT and sensitivity to it in acne, you can see where the link is. And so collectively, these ingredients almost always allow us to see an improvement in someone's acne and improvement in the overall quality of their skin, even before we've commenced our in-clinic treatment program. One really needs to look at why someone is getting flare-ups with their acne. You know, is it cyclical? Is it related to their periods, if in the case of women? Or what else is there? You know, are there other stressful factors, etc.? So often I think, like with many things, you need to have a holistic approach to this, and certainly strategies to manage your stress can be a key factor in helping minimize flare-ups. If there is a hormonal component, strong hormonal component, it's certainly worth discussing it with your GP. There may be hormonal medication, you know, using the use of contraceptive pill, which can sometimes help, but this really needs to be discussed with someone who really understands skin and hormones. And then really just examining what you're doing in your regime, because it may be something you're doing that's actually causing these flare-ups. A lot of people will have good ingredients in their products, but they're overusing these. And as mentioned many times before, these ingredients can be good to a point, and then they can just, you know, aggravate the skin. And if you aggravate an inflammatory skin condition, and acne is an inflammatory skin condition, then you're likely to offset the environment such that you're going to end up with more spots. So the key principles are to get an optimal pH, optimal hydration of the skin, and have the right ingredients that are going to nurture your skin as much as actively fight the pathological processes of acne. So I often say it's like, you know, raising a child or a pet. You have to have the right combination between discipline and love, and that's what you need with your acne. If you do that, you should minimize the number of flare-ups, or ideally eradicate them completely.